Urinary tract infection (UTI) is a common bacterial infection that affects the urinary system. It can occur in any part of the urinary tract, including the kidneys, bladder, ureters, and urethra. UTI is more common in women than in men due to the shorter length of the urethra in females, which makes it easier for bacteria to enter the urinary tract. Mechanism of UTI. The urinary tract is normally sterile, meaning that it does not contain any bacteria or other microorganisms. However, sometimes bacteria from the bowel, especially Escherichia coli, E. coli, can enter the urinary tract through the urethra and multiply in the bladder. From there, the bacteria can spread to other parts of the urinary tract, causing infections in the ureters or kidneys. In most cases, the body's immune system can fight off the infection, but sometimes antibiotics are needed. Symptoms of UTI. The symptoms of UTI can vary depending on which part of the urinary tract is infected. Common symptoms of UTI include a strong, persistent urge to urinate, a burning sensation when urinating, passing frequent, small amounts of urine, cloudy, dark, bloody, or strong-smelling urine, pain or pressure in the lower abdomen or back, fatigue and fever, nausea and vomiting. If the infection spreads to the kidneys, it can cause additional symptoms, such as pain in the side or back, high fever, chills, nausea and vomiting. Causes of UTI. UTI is caused by bacteria that enter the urinary tract. The most common cause of UTI is Escherichia coli, E. coli, which normally lives in the colon. Other bacteria, such as Klebsiella, Proteus, and Staphylococcus, can also cause UTI. Risk factors for UTI include being female. Women are more prone to UTI than men due to the shorter length of the urethra in females. Being sexually active. Sexual activity can introduce bacteria into the urinary tract. Using certain types of birth control. Certain forms of birth control, such as diaphragms and spermicides, can increase the risk of UTI. Having a history of UTI. People who have had UTIs in the past are more likely to get them again. Having an enlarged prostate gland. An enlarged prostate gland can obstruct the flow of urine, making it more difficult to completely empty the bladder. Having a weakened immune system. People with weakened immune systems, such as those with HIV, AIDS, or who are undergoing chemotherapy, are more susceptible to infections, including UTIs. Treatment of UTI. The treatment of UTI depends on the severity and location of the infection. Mild UTIs can be treated with antibiotics for 3 to 7 days. More severe infections may require hospitalization and intravenous antibiotics. Antibiotics commonly used to treat UTIs include trimethoprim, sulfamethoxazole, Bactrim, Septra, nitrofurantoin, Macrobid, ciprofloxacin, Cipro, levofloxacin, Levaquin, amoxicillin, Amoxil, Trimox. It is important to finish the full course of antibiotics, even if symptoms improve, to prevent the infection from returning. In addition to antibiotics, doctors may also prescribe pain medication to relieve discomfort. Drinking plenty of fluids, especially water, can help flush bacteria out of the urinary tract. Avoiding irritants such as bubble baths, feminine hygiene sprays, and powders can also help prevent UTIs. To prevent UTIs, it is important to practice good hygiene, including wiping from front to back after using the toilet to prevent bacteria from spreading from the anal area to the urethra. It is also recommended to urinate before and after sexual intercourse, as well as drinking plenty of fluids to promote frequent urination and flushing of the urinary tract. For individuals who are prone to recurrent UTIs, doctors may recommend long-term or preventive antibiotic treatment, or low-dose antibiotics taken daily or after sexual intercourse to prevent future infections. In conclusion, UTI is a bacterial infection that affects the urinary tract. It can cause discomfort and pain, but can be effectively treated with antibiotics. Practicing good hygiene, maintaining hydration, and taking preventative measures can help reduce the risk of developing a UTI. If you suspect you have a UTI, it is important to seek medical advice for proper diagnosis and treatment. Subscribe for more informational videos.